This is One on One. Warren Geller is President and Chief Executive Officer of Englewood Hospital and Medical Center. Good to see you, Warren.
Great to see you again, Steve.
You were just telling me before you got on the air, you've had a pretty good year.
Yes, indeed.
How do you explain that? I mean, with all the uncertainty and some say instability in the healthcare landscape environment, how do you explain it?
I explain if I started 5 years ago, being proactive and seeing the changes in healthcare, going beyond the four walls of a medical center and creating an infrastructure out there in the community for convenience for patients and really just adjusting to what was coming down the pike.
So as you talk about the ACA, the Affordable Care Act, Obamacare, how the heck, first have you gotten ready for it, and now with the implementation of it, do you sit there and go, how does it affect our bottom line? Or do you say, hey, it's a way of life and we're going to deal with it anyway?
I would say it's a combination of both. Obviously, the bottom line is important because we constantly need to reinvest in the community. But we also need to say, you know what, we're here for our communities and it's the new way of life. It started by becoming more efficient, looking inside the hospital and how we could be the high quality, low-cost provider in the region to be most competitive.
Give us an example of what that means, because no one's going to disagree with what you just said, because efficiency, hey, efficient, we like that. Give us an example of what you have done at Englewood that makes that real.
Yeah, it starts with what you're building out there, getting the patients when they're well, giving them the information. So if somebody does come in for a cardiac surgery procedure, we have a successful surgery, an efficient surgery, have an excellent length of stay, move them from a cardiovascular ICU to a step down more quickly, maybe go home with home care rather than go to subacute rehab afterwards. It's a less expensive, more efficient model of care with the best outcomes.
And you're also saying off air that cardiac surgery is up?
Yes. Cardiac surgery was up by more than 20% in 2013.
How about the rest of the country?
The rest of the country in the last 10 years, CABGs alone, so traditional coronary artery bypass graft, open heart surgery.
I didn't know what that acronym was, but go ahead.
Is down by over 50% in the last 10 years. And we were up in overall hearts by, like I said, over 20%. We did 340 hearts, and our case mix index was high, which means our patients were really sick. It measures the severity of their illness. And again, we were at the top of the state report for cardiac outcomes each year.
You know, it's interesting. You use the term severity of illness. From a layperson's perspective, how is that measured?
It's measured by the disease, by the comorbidities the patient's suffering from, everything else surrounding the illness within that patient.
It's interesting. The other part of this whole process is physicians. Physicians are the more, as folks who know our programming, we do an awful lot of medical, clinical, health-related programming. Physicians are playing a more and more, just playing a critical role in healthcare today. How is it that at Englewood you are recruiting and then retaining the best physician leaders out there?
Well, talent attracts talent, and we have an award-winning, superb medical staff at Englewood Hospital. And what we've done is embraced our physicians, partnered with them, set up a captive PC that's physician...
Captive PC?
Yeah, it's a professional corporation. It's a physician group, multi-specialty physician group, run by physicians, led by physicians, where we partner with our physicians, because physicians know how to best care for their patients in the office. And if you partner with them and wrap around a great medical center around them, and the pre-care and the post-care, whether it be an ambulance service in all the towns we serve, to partners in skilled nursing facilities and rehab, you really have a wonderful model across an integrated delivery system.
And for a CEO like yourself, do you find that the role of a CEO in a hospital today, just as opposed to 10 years ago, because before you were the CEO, you had a previous role on the executive side as well, and you've interacted with other CEOs for years. But just say 10 years ago, do you think the role of a CEO in a hospital like yours is different today than just 10 years ago.
Absolutely.
How so?
Absolutely, Steve. It's different in the fact that 10, 15 years ago, you were buried in a lot of numbers and spreadsheets, and you talked about that bottom line earlier, and now it's about being out there, talking to all the different community groups and saying, what are we doing well? What can we do differently? What should we be doing at your community hospital, your medical center? Because remember, we're really owned by the community. We're there for the community. We're a not-for-profit.
People forget that you're nonprofit.
Yes.
You know, it sounds like an oxymoron, though, because you're a nonprofit, but you do have to run an efficient operation and have a bottom line. You're just not making a profit.
Right. We've had a surplus from operations 7 years in a row now. And what it means is that we take that surplus and it's reinvested in the medical center, which in essence you're reinvesting in the community. You're doing more community outreach. We did over $20 million in unreimbursed care last year for our community, which we're extremely proud of.
Which means you don't get any money back for that.
Right. We did about $23 million in total, and we received a little bit less than $2 million in reimbursement on that amount.
Warren, before I let you out of here, I want to talk about the Cancer Treatment and Wellness Center. The Cancer Treatment and Wellness Center. What is it and why is it important?
The Cancer Treatment and Wellness Center is going to be a 180,000 square foot structure when it's all done of comprehensive care for cancer. So anything a cancer patient needs, all in one center. The convenience of a dedicated drop-off. You see the same valet and the same concierge and the same nurse physician down the line in one location. You won't have to enter the hospital proper, but it's right there on campus.
Why is that important?
It's important because when you're sick, and if you need a long course of radiation therapy, you really need to consider not just the patient's needs, but their family's needs as well. If it's the middle of the winter, a winter like we've had this year, and you have your 80-year-old mom or dad and they need your treatment and you have to bundle them up and bring them out for their treatment, you want it to be convenient. You want the latest and greatest technology. You want all the experts there, from the medical staff to the nursing staff to everybody else that cares for that patient. And it's nice to have it all in one location, especially when it begins with a diagnosis. Because once a patient hears that they have cancer, they get a little glazed over. You start to hear white noise. But if we could say, here's a navigator, they're going to bring you right down the hall so you could meet your potential breast surgeon. And they could discuss things with you about your care. That's different than the old days of handing someone a business card and say, call this office on Monday and they'll take care of you.
Talk about feeling alone.
Right.
It's interesting, in a few seconds we have left here, and you're treating cancer, you're not just treating it from a clinical point of view.
No, you're treating the whole patient, and that includes their family. It absolutely is all about that. On our building, our Cancer Treatment and Wellness Center, it's the Russell and Angelica Berry Center for Humanistic Care. And that's not just a word. We take that very seriously.
Yeah, Dr. Arnold Gold, who started that whole initiative, is important stuff.
Yes,
Thank you so
indeed.
much, Warren.
Oh,
Good stuff.
thank you.
Appreciate
Always
it.
a pleasure.
Good.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Activists in cooperation with the American Medicine Chest Challenge, Choose New Jersey, NJIT, Health Republic Insurance of New Jersey, the New Jersey Education Association, Berkeley College, and by the Healthcare Foundation of New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.